An attack on the heart. Acute coronary syndrome, ACS, is a group of symptoms that occur when the blood vessels in the heart become inflamed. A combination of one or more conditions that resulted in an obstruction in the heart's blood supply, resulting in a myocardial infarction. Myocardial infarction. The heart is a muscular organ that pumps blood around the body. Organ that circulates oxygen-rich blood to the rest of the body, as well as nutrients. The main pumping chamber is the left ventricle. The heart's upper chamber and contracts to deliver oxygen-rich blood to the rest of the body. Several smaller vessels run through the aorta. Coronary arteries are a type of artery that runs through the heart, connected to the aorta and provides blood to the heart. The heart's muscles with the required nutrients and oxygen. There is a risk of death in people who have acute coronary syndrome. An obstruction in the passage of blood through the arteries. Coronary arteries are generally clogged as a result of a heart attack, a sclerotic plaque or a coronary artery, aortic spasm or a coronary artery occlusion. In the case of atherosclerosis, the dissection, the formation of a fatty plaque continues as a result of the concerned area being narrowed. This plaque ruptured in a coronary artery, as a result of which a blood clot forms, resulting in an obstruction of the development of a coronary artery involves. The most prevalent cause is a blood clot, other than a coronary artery blockage. Coronary artery disease is caused by a variety of factors. A coronary artery spasm is one type of obstruction. This is brought about by the use of medicines, ice-cold smoking, weather, or a period of intense stress that results in a abrupt coronary artery constriction, or a dissection of a coronary artery. The inner surface of a coronary artery separates, causing an obstruction in the system. A stifling of blood flow, such as an obstruction in one or both. As a result of the coronary arteries, oxygen is produced. When nutrients are not getting to the part, it causes the heart to be supplied by it, resulting in a syndrome in which the heart muscle dies. Myocardial infarction is the medical term for a heart attack. Symptoms of a coronary artery blockage include pain or discomfort that comes on suddenly, a feeling of tightness or a burning sensation in the angina is a condition that affects the chest and can last for a long time. Upper abdomen, shoulders, arms, and neck. Alternatively, lower jaw. Angina can strike at any time, whether it is at repose or with a series of attacks, even mild bouts from occurring. Physical activity is referred to as insecure. Angina pectoris is a type of angina that is widely seen in people. Other signs and symptoms of acute coronary syndrome. One type of acute coronary syndrome is angina pectoris. Dizziness, breathlessness. 3. Sweating is a therapy for nausea. Acute coronary syndrome, ACS, or a myocardial infarction, entails one oxygen at the following. Therapy aimed at increasing the amount of oxygen in the body delivered to the heart and blood. 2. Antiplatelet therapy or aspirin to avoid blood clots. TPA is one of 3 thrombolytic therapies. Or streptokinase to dismantle what is already there. Clots in the blood to relax with nitroglycerin and morphine. The coronary arteries and relieve the symptoms of coronary artery disease. Pain. 5. Blockers that lower the heart rate. As a result, the oxygen level drops. Requirement: a total of 6 coronary angioplasty procedures. An interventional procedure is one in which a doctor performs a procedure on a patient. A catheter with a balloon tip is inflated to open a blocked coronary artery from within. It with a stent. 7. Keep the coronary artery patent. CAB stands for coronary artery bypass grafting. A surgical procedure that is pronounced like a cabbage. A procedure in which a clogged coronary artery is unblocked. A vein or a stent is used to bypass the artery. In order to use artificial graft material, re-establish the heart's blood flow.